I'm Dr. Ange Mack. Welcome to Your Health, It's Personal. This program is dedicated to educating our community on the benefits of integrative medicine and whole person health to include complementary therapies and self-care so you can live your best life. Today, I am very excited to have with us Dr. Leigh Frame. She is the director of the George Washington Integrative Medicine Program's graduate training for healthcare professional and the executive director of the George Washington Office on Integrative Medicine and Health. She received her PhD in human nutrition from the Johns Hopkins Bloomberg School of Public Health while working at the Johns Hopkins Center for Bariatric Surgery, and also received a Master's of Health Science in Immunology from the same school. Her interests include the potential role of the microbiome and nutrition in health, the consequences of malnutrition in obesity, research ethics, and social media. Dr. Leigh Frame, thank you so much for being with us today.
Thank you for having me. You did a great job. That was kind of a mouthful.
Yeah, I think I got it all spelled out. Said pretty well there, considering. Thank you for being with us. I'm excited to have you on board because as an integrative medicine professional myself, I understand the huge importance that nutrition plays in the foundation of our health and our life and how we live our life. And it's great to have a professional and someone with your expertise on board to explain this in a little more detail in layman's terms to just, our general population and our viewers. But let me ask up front, how did you first get interested in this whole area of nutrition and health and healthy living?
It's a great question. Well, first I'd say you totally nailed it when you said that nutrition is the foundation of health. And that's part of the reason that I ended up getting into nutrition is that without proper nutrition, things start to go wrong. And one of the things you start to see is your skin. It's right there. It's the easiest thing to see that's going wrong. And I started to get really interested in the relationship between what you ate and people's skin health. I was noticing people eating different things, had different skin. And when I changed my diet, my skin would change. And this was when I was in high school. So I was young and already noticing how important nutrition was.
Right.
And then I found out that there's a whole wealth of science behind that, biochemistry, real basic science, and it's being translated into clinical research. And that's when I decided I wanted to do nutrition research and started down that very long but very rewarding path.
So yeah, this sounds like it's a very important and personal path for you as you went forward. I know when I studied Japanese medicine and we started looking at, gut and gut health, it didn't take us too long to really determine, well, it all kind of starts in your gut. If you're not properly assimilating the nutrients and getting them into your system, into your blood and up to your brain, then you're not really able to, utilize that nutrition and it just passes through you. So why do you think, with regards to the studies and the curriculum that you developed with George Washington, why is this important for physicians and healthcare providers to know? Because it's not readily known, right?
Mm-hmm.
That's not usually the first thing your primary care doctor will talk to you about is your gut and your gut health. And I think it should be.
I couldn't agree more. And I actually do have a personal story to explain that. And I think this is part of the reason I'm interested in integrative medicine myself is I was 7 years old and had joint pain. And throughout my life, I had symptoms of arthritis and I'd been tested for everything you can imagine. I saw probably 24 doctors who didn't know what to do with me. And then it wasn't until I was 30 years old that I was diagnosed with celiac disease, which is an autoimmune disease. And as soon as I changed my diet, which is how you control celiac disease, you remove gluten from the diet, all of those symptoms were gone. And I never realized what other symptoms I had. I didn't realize how bad I felt, how I had brain fog and I'm fatigued and I was grumpy. I didn't know that because I didn't know anything different. So that for me was transformational. And also how long it took me to figure that out was also transformational. And I realized there's something wrong with our healthcare system. And it's largely because our healthcare providers are not trained on nutrition at all. And those who do receive nutrition training, it's not sufficient. And it's often very much based in biochemistry, which is great, but it's not something they know how to apply when they see a patient. So they feel uncomfortable talking about nutrition, even if they have the nutrition training. And so that's what the program at GW is designed to fix, is to give the opportunity for physicians to come back get a master's degree, learn about the integrative approach, the whole person care, and then really take a deep dive into nutrition. So that way, when they go out there in the world, they feel confident about talking about nutrition to anyone, their patients, someone on the street, colleagues, which we're hoping they'll be ambassadors for nutrition. So definitely colleagues.
Mm-hmm.
And so we hope that this will be the beginning of change to our healthcare system.
And I hope so too. I really do. I know I've gone into doctor's offices before and asked them to run, kind of a separate panel, on my gut health to try to rule out some things, and they didn't even know where to start. So let me ask you, I always kind of go a little bit towards like the functional, someone board in functional medicine, because I know they have they can run those complete panels and they do a way deeper dive, more extensive and more comprehensive than a regular gastroenterologist. So what would you just tell, a person that a friend, as far as getting checked out, if they had like symptoms of celiac, they don't digest, they bloat, they're always tired, depression, all of these things could be linked to your gut health. Where would you guide them?
Yeah, unfortunately, this is not something that's easy, and you absolutely have to be your own advocate. I was diagnosed in the middle of my PhD in nutrition, so I was probably the best person to be my own advocate, but it still took me forever. So if I can impart some of my knowledge, I'll be glad to do that. And I would say the best thing is, and it's very old-fashioned, but keep a food log. Write down everything you eat, the time that you eat it, and how you feel throughout the day. And then you can try and start to notice patterns. And it can be difficult because it's not necessarily the last thing you ate. It could be the thing before that. But you can notice patterns like, oh, every time I eat in that same day, I feel this way. And one way to really get detail on that is actually take things out of your diet. So you can do an allergy removal diet.
Like an elimination diet?
Yeah, like an elimination diet. Yeah, exactly. So you can take out, say, the top 8 allergens and slowly introduce one back into your diet and see how you react. It can be a little bit difficult to do that when you're just learning, because, for instance, gluten, at least it used to be in everything. Now they've taken it out of a lot of things, so it's gotten a little easier. But as you're starting this, the hard part is going to be actually making sure you really are eliminating that from your diet and you're not getting some sort of secret source of it. For instance, soy sauce is one of the ones that people frequently forget. So if you've taken wheat out of your diet to see if that's an issue and you have soy sauce, then you've actually not taken it out of your diet. So it can be a little tricky, but I think it's worth the effort.
Right. Yeah. I've heard food logs are a great way to start and kind of get down to getting everything out of your diet. I actually did that when I was nursing or trying to figure out what my son was allergic to. Ended up being meat. So, but on a different note, there are different degrees in nutrition. There are different certificates in nutrition. If someone just said, I don't really feel comfortable, I don't really know what I'm doing with regards to reading labels, should they seek out a nutritionist? And if so, what credentials should that nutritionist have?
That's a great question. There's a lot of different answers to that, which is a good thing, I guess, about nutrition is there's a lot of variety. So we've got your registered dietitian or your registered dietitian nutritionist, RD or RDN. And that's the person who's really capable of seeing you clinically. So they know about drugs, they know about nutrition, they could talk to you about anything related to your health. They're the person you would see probably if you went into a hospital. And they're really easy to find too. So you can just go and Google our registered dietitian or go to their board and find them that way. But the growing area now is nutritionists, and these are people who they know a lot about nutrition and food, and they know a lot about behavior change and lifestyle and how to make it work for you. So where they might not be able to talk about the interaction with your medications and nutrition as well, they'll really be able to help you implement it. And so if your question is about like food labels and those type of things, a nutritionist might be the person to look for. And their certification is a certified nutrition specialist, or CNS. And that's actually what our program provides, is a CNS, which is the credential that is most commonly seen for physicians, because they obviously don't need to go get another degree or another credential to practice. They already have all the credentials they need, and that's what an RD would provide. Whereas the CNS is more, okay, I know about nutrition and I can counsel you on it. So a lot of health coaches or even personal trainers are really interested in doing that, so they can provide evidence-based nutrition counseling instead of whatever their CrossFit gym was telling them about. They actually want to get the truth. So looking for the CNS credential can really help with that.
Okay, so they look for that, and if they were hoping to get this reimbursed through their insurance, are there things that they need to look for with regards to, okay, does my Blue Cross Blue Shield cover this? Does my retired TRICARE cover this? How can they find out? Do they just have to call their own insurance company to see what's covered? What's the best way for them to see if this is covered?
Yeah, that's a great question. And unfortunately, as with everything in our healthcare system, the answer is it depends. So you do have to contact your health and provider, and you probably will need a referral. These are considered specialists, so you won't be able to just walk in their door frequently with your insurance policy. And unfortunately, sometimes RDs are not covered. And this is very frustrating to me because if you have a nutrition issue, you really need to see a registered dietitian as a clinician, as opposed to, your primary care physician who has not had any nutrition training. So that is something that you'll have to look into. And a certified nutrition specialist, they are becoming covered. And in many cases, actually, states are requiring that that CNSs be covered over RDs because it's a master's level degree. So you have to have a graduate level education as opposed to an RD. You used to be able to just have a bachelor's. So that's kind of an area that's changing in a state to state. But I would say the nice thing about CNS is a lot of them are really marketing themselves to people whose insurance doesn't cover nutrition counseling, or people who maybe don't have insurance and need to pay out of pocket. And so their fee structure is set up for that. So if you know that you won't be able to go see an RD in a hospital, for instance, they won't cover that, then maybe the CNS credential might be better for you, because they could do, for instance, a lot of telehealth.
Right,
Our
right,
students
yeah.
will do that, like a 15-minute session with you once a week. And that's going to be more affordable.
Exactly. Telehealth would be great for this kind of thing because you don't necessarily need to be touched and sitting in front of a person. So
Right.
possibly offered, a little more, feasible financially, for someone to go and do a telehealth appointment with a nutritionist. I want to get back to the personal symptoms, because I think this is really important with people. I know people, and I've known people for years that I'm certain have issues with their intestines and their gastrointestinal system, but they're so used to their symptoms, they don't know what normal should feel like. So you said with you were having symptoms since you were like 7 years old, but that was your normal. And I've read and researched and learned that, and add on to this, I mean, you could have symptoms from anywhere from just a little bit of pain when you eat to bloating, to constipation, to, diarrhea, like any of the extremes. And then also fatigue, depression. I've seen people that they thought they had bipolarism, and it was actually just, a nutritional and a gut health problem. Tell me a little bit more about some of these symptoms that people might experience and just not associate that there's something going on in their intestines that is off.
Yeah, that's a really important point. And one of the ones that you didn't mention, I think that people don't associate with gut health, is actually headaches and migraines. So a lot of people will get headaches due to basically a reaction to a food. And if you remove that food, you no longer will have these chronic headaches. Now, again, finding that can be difficult. You got to work on a food log. But that's why I think paying attention to how you feel as a whole person, right? Like looking at every portion of your body on a daily basis and being like, am I feeling different today? And if so, maybe did I eat something different? If I'm keeping a food log, if you use my Fitness Pal or something, and it's an app and it's pretty easy to track things on a regular basis, and you're just looking to optimize your health, that might be something to do, right? Just
An app.
every time, lock it in there. Yeah. And then think about that day. How did I feel throughout that day? What points during the day did I feel fatigued, or did I get a headache? Maybe it's because you didn't have your coffee, which is a whole other problem, but maybe it's because you have a sensitivity to gluten and you ate a lot of gluten that day. So it's something you have to pay attention to.
An app and an app food log is actually a great idea. Most people have access to a phone and can download a free app. I don't know if that was a resource that you provided that we're going to give later, but if not, maybe we could get a good food app recommendation from you as well.
Yes, I can definitely provide some recommendations, and I did not do that. But most of them have free they're completely free, and then there's just upgrades or premiums that you can pay if you want additional features. But the free version is usually more than sufficient if you're just trying to keep track of how you're feeling.
Sure. And I believe that some of the physicians, especially now that some of the physicians are having or had to have moved into more telehealth work, that they have some of these apps and logs that they're giving to their patients so the patients can track and give it back to them. So maybe the person should ask their physician first and see what the physician could provide to them. I'm just kind of like thinking out loud, but
Yeah.
first
That's
step.
a great idea. I know that, for instance, some of our providers have particular apps that they feel more comfortable with because they've been using them. So it may be helpful to work with an app that your provider is familiar with because they can talk to you about how best to use it.
Yes, yes, exactly. Now, I think this is such essential information. We can get our nutrition right, and we can get our gut healthy, so we can absorb the nutrition we're taking in. And I think you will see just very observable and measurable outcomes, especially with regards to the fingernails and the skin, like you were
Yes.
saying, healthier nails and skin.
And
Sure.
hair.
Yeah, hair. The eyes can get more clear. So
Mhm.
so many things you can pay attention to.
Which is something that the Asian medicine cultures have recognized for centuries and utilized heavily in their diagnosis. And we've kind of gotten away from in Western medicine. We want to run a test rather than just looking at a patient. So I hope that that's something that we can bring in as an integrative medicine approach, and really get back to some of those basics where you can just look at someone's eyes or their skin and hair and be able to say, all right, you probably have a nutrient deficiency. Let's figure out what's going on here.
Yeah, it was fascinating when I was learning shiatsu and Japanese medicine. We were looking at skin tone and hue and fingernails and all these things that I guess maybe on some level you were kind of noticing, but you weren't really taking it into account with regards to the status of their health. And if do they have a liver issue? Do they have a kidney issue? So so many great things that I know the George Washington Integrative Master's Program has. And we have about 5 minutes left. You can just give us a little more information on the George Washington Integrative Medicine Program and who might be interested in taking this course or portions of this course.
Excellent. So we have a master's degree and a graduate certificate, which is like a half a master's. And it's open to really anyone who's interested in healthcare, or wants to become part of healthcare, because you don't necessarily have to have credentials coming in to practice. For instance, you could have the CNS when you graduate with a nutrition degree. But we do have a lot of physicians, and originally this program was designed for physicians because they're the frontline providers. And if we can change the way physicians provide care, then hopefully we can change the whole healthcare system. But really, anyone. We have a lot of nurse practitioners. We've had yoga instructors, personal trainers. We have this term coming. We have a nutritionist for an MBA team. So really, all sorts of different people. And what they all want is to be able to provide their patients or clients with support. So they're not just going to tell you what to do, right? They want to help the patient or client come out with the best plan for them to optimize their health and wellness. And that's all of them. So that includes meditation, self-care, nutrition, and all of our providers, even the ones who don't go through the nutrition concentration, get a lot of nutrition training because it is foundational, like we've talked about. If you don't have a good diet, then everything else we're doing is kind of wasted until we get to that healthier diet.
Exactly. And you bring up a great point with regards to the physician or the nurse or the health coach or whoever's going through this program. They are basically trained to educate their patient and their clients on how to take care of themselves. And I think it all comes down to what we can do for ourselves. Yes, we can see a doctor. Yes, we can get some great guidance. But in the end, it's our choices. It's how we decide we're going to live and how we're going to move forward and get ourselves healthier. Maybe our families and friends around us healthier as well. So all this is fabulous information. For people wanting to learn a little bit more, can you offer a website or some resources? And I'll just tell our viewers too that we will have this on my Dr. Ange Mack blogspot and the YouTube when it comes out. So if you don't get it as we're speaking, you can refer to those two resources as well.
Yeah. So one thing everyone can do is use social media. You can follow me. I'm on Twitter, Instagram, and LinkedIn. Oh, and I have a Facebook page too. So choose your poison. And I do try to just put out the evidence-based nutrition as it's coming out. So it's more up to date. A really great resource that you can just refer to at your own leisure is the Harvard School of Public Health's Nutrition Source. They have a website with all sorts of great articles, and they also have a monthly newsletter you can sign up for. And again, really evidence-based. It's not going to be fad-based or trendy. It's what the science is saying. So those would probably be the best resources for you. I have a few others I can tell you about, including the GW Integrative Medicine podcast. That one is maybe a little bit more advanced, but if you're a healthcare provider or a really educated consumer, I think that you will find it very interesting. And because I am one of the co-hosts, it's very nutrition heavy. So if you're interested in nutrition, I would suggest checking that out.
Those are some great resources. And I got to laugh, Leigh, because you said choose your poison, which was like such a great thing for, a nutritionist to say, poison, like one of those levels of me. So, but thank you so much for being with us today. Loved talking to you about this topic. There are like hundreds of avenues we could go off of from here to discuss in more detail. And maybe we will later on. Would love to get back with you at another point in time. But
absolutely.
Until then, have a great rest of your week. Stay well, so stay healthy, stay happy. And for my viewers, you can find me on Dr. Ange Mack YouTube. And until next time, I hope you strive to live your best life.